Could we just look a little bit, Ron, at the regulation of dermal fillers? Because in the UK we're very unregulated compared to the rest of the world.
Well, we are, and I think with dermal fillers have never been regulated. Lasers and light were regulated in England by the CQC and were deregulated in 2010. And I think there is a call for, some form of regulation for both of those particular procedures, and obviously botulinum toxins as well. At the moment, I think people are unsure whether or not it should come back through the CQC or whether it should be handled like it is in London by some of the local boroughs, which regulate currently the lasers and light procedures but don't look at the injectable side of things. Personally, we run a clinic that's registered by the CQC, and if you look at the CQC and the faith in that as an organisation now as well, with problems that they've had, for instance, at Staffordshire Hospital, where clearly even regulated hospitals where you have inspectors go in, there is clearly some evidence of failing there. And in fact, the CQC itself as an organisation is actually being looked at internally as well.
Yeah.
So for me, I think the critical aspects really relate more to, the people that are allowed to handle these products. So in other words, the debate about who should and shouldn't do these treatments. And also clearly the training requirements and having some form of competency based into that where possible.
And what does this mean for people in the industry? I mean, this is recommendation for a discussion document, isn't it, more?
Well, yeah, it is at the moment. I think really this committee have come in with an open mind, and what they're doing is obviously looking at with the call for evidence, looking at different parties involved, whether it's a consumer or whether it's a supplier or a clinic, and just trying to gather evidence, as they said. They are now ongoing and going and trying to get further detail from selected people, and especially people who've actually pitched in and with ideas and people who want to comment. And they're going to summarise this and come out potentially with recommendations in the spring.
At this stage, obviously we've had the interim report, but we haven't had any sort of formal report. We're waiting for that later in the year. So I think we agree with the principles of the interim report, but I think we'll just have to wait a little bit to find out what the full report says later in the year.
That's it, whether they will be enforced or not, and exactly what will come out. Well, I don't think anyone really knows. And parallel running to this is the European side of things. So this is SEN, and this is looking at cosmetic surgery from a European regulation perspective. So this is something that's a totally different route of looking at regulation, where I think probably more so they are concentrating on the aspects of really who can and can't do what.
Who can do treatments is much more regulated in Europe, in France and in Germany, isn't it, Ron? Can you just talk us through some of the regulation issues and who's allowed to do the treatments in Europe?
Well, it is, and I think there is this big area debate about, I think particularly outside of cosmetic surgery, where I think it's probably clearer, and certainly here where we have the specialist register, where I know there are people who have a certain angle on that as well, and say, well, just because you're on the specialist register doesn't mean to say that you can perform all cosmetic surgery procedures. But sort of outside of that, really I think the key area of concern from my perspective, the non-surgical side, is looking at this medical versus non-medical specialties being involved in the injectable side of things. And the interesting thing looking at this was that it appeared to be very split when they looked at the dermal filler argument and botulinum toxin as to whether or not non-medical or medical people should be involved.
Absolutely.
So clearly really principally the beauty therapy side of things, and their lobbying front with BABTAC and other sort of organisations within there are obviously trying to push the case forward for beauty therapists to be practically involved in dealing with injectable treatments.